I am Dr. Neha Chaudhary. I am a consultant breast surgeon at Narayana Super Speciality Hospital, Havda, and at Rabindranath Tagore Institute, Mukundapur, Kolkata. Today I will be telling this video especially for my patients, and I will be telling about what are the precautions and what is the care that they need to take after a surgery for breast. So breast cancer surgery can usually be either a breast conservation surgery where we remove only a part of the breast, or a mastectomy where the entire breast is removed. After a breast conservation surgery, we usually discharge the patient on day 2 or day 3 and send them home. And a lot of our patients have a lot of questions. They have various questions about when to take bath. The patient is discharged usually with a drain or a pipe with a box, and they are asked to take it home and take care of it. And they have a lot of questions regarding the drain. So I will go step by step. The first uh, point is care of the wound. So what do you do with the stitch line, the drain area? What do we need to do? The most important thing is to always take a bath. When we send the patient home, we usually send them home without any dressing. We remove the dressing in the hospital and send them home. And at home, the patient is supposed to take a bath. Take a regular bath. You can use any medicated soap. You can use Bacto scrub. You can use Dettol. Even regular soap and water is okay as long as the water is clean. Once the patient has taken a bath, you can keep 2 towels. You can use the first towel to first wipe the water, and then again the second towel to tap dry, clean the drain box, clean the drain side, make the area absolutely dry. After that, you can apply ointment mupirocin at the stitch line and at the drain side. I would also advise the patients to wear light, easily breathable clothes in the first after the discharge till the stitches are there. Maybe a front open dress so that opening the dress and wearing it back is easy. And keep the area clean, dry, and well aired. Now a lot of patients have apprehension that they don't take a bath, what will happen if the water goes inside? But that nothing like that happens. After 24 hours, the wound is closed, the epidermis is closed. So the upper layer of the wound is anyways closed. The water will not go in. Even if the water goes in, nothing will happen. The drain is a closed system, the drain box. Water cannot go inside that also, so you can put water on that also. Okay. Now the next step is care of the drain. So we usually send the patient home with a drain, and that drain has to be emptied every day and measured. So how do you empty it? There is a system to empty it. There is a lock. So the first thing is to close the lock. After you close the lock, then you open the drain, empty it into a cup or a disposable container. Take a syringe, a 10 ml or a 20 ml syringe, and measure the amount of fluid with the syringe and discard it. And then you have to maintain a chart for whatever next 10-15 days. You have to write down a date, what is the amount of fluid in the last 24 hours, what is the color of the fluid, and you have to maintain that chart. So this chart is needed when you come back to me for drain removal or suture removal. The thumb rule is we usually remove the drain if the quantity of drain is less than 50 ml for 3 consecutive days, or approximately 15 days after the surgery, even if the drain amount does not come down. There's certain red alert points for drain. If the amount of drain is coming is very high, it is very high colored, as in it's like a thick frank blood, or if too much drain amount is coming, or if there is a swelling at the drain site, or if there is a swelling just under the wound or in the armpit, then don't panic, but you have to come and visit. There are some times when the drain gets blocked and there is leakage from the side of the drain, from the drain side. At that time, there is no need to panic, or even if the drain gets pulled out and the holes of the drain come out, there is no need to panic. Just put a few sterile gauze there, and the next working OPD day, come and meet me in the OPD. You have to take care that the drain doesn't get pulled. What you can do is you can buy a cotton bag, what we call as jhola, and put the drain in it and put the bag on your shoulder. That way your hands will be free, you can roam around, and there will be no pull at the drain side. That will keep you comfortable. Now coming to the third part, which is lymphedema care and arm care and physiotherapy. So after a breast cancer surgery, because we have targeted the axillary nodes. Axillary nodes are small glands in the armpits which need to be removed for any breast cancer surgery. We could have either done a sentinel node biopsy or a complete axillary clearance, depending on what is the involvement, whether there's an involvement of a node or not. Either way, you have to be very careful about one thing which is known as lymphedema. Lymphedema is when the arm starts swelling up. There is buildup or accumulation of fluid in the arm because that fluid is not able to return back to the body. Now, how do you detect it? There will be some heaviness in the arm. You will feel some uneasiness. You will see that there is some swelling in the entire arm compared to the opposite side. Then you can understand that there is a little bit of lymphedema happening. For lymphedema, it is always better to detect it early and manage it early, because if it is detected early in the initial stages, we can reverse it, manage it. But if it is detected late in the later stages, then it gets usually a fixed hard lymphedema, which is very difficult to reduce. So the lymphedema management starts from day one after surgery. What do you need to know? You need to be very careful about your arm, that there is no additional injury to the arm. So anything which can cause too much of injury, maybe if you're cutting vegetables, you have to be careful that you don't injure the hand. You have to avoid any needle pricks, any injections, taking too much of blood pressure on this hand, or wearing tight clothes, tight bangles, tight rings, glass bangles, because they break and cause micro injuries, micro ulcers. All these things you have to avoid. You have to avoid lifting very heavy weights with that hand. You have to avoid too much strenuous activity with that hand. It doesn't mean you cannot do day-to-day regular activities. Anything which is there, which is part of your regular activity, like maybe cooking or playing a sport or doing any other work, you can do it. You just have to be careful. The second part is arm exercise and physiotherapy. So while you are in the hospital, during your stay, you will have a physiotherapy consultation, and the physiotherapist will teach you certain exercises. Now you have to follow it very strictly. Those exercises have to be done daily, regularly, and they have to be continued throughout the life, because those exercises will keep your hand movement proper, they will keep your hand healthy. Coming to the next part, for patients who have had breast conservation surgery, as in whose breast has not been removed, it is also very important to wear a bra, because that will give support to the operated breast. There will be no pain, the pain will be lesser, the pull on the stitches will be lesser, and it will help in the overall recovery of the patient. So these are the few points. I am sure there are a lot of other points. I am always available. You can ask me in the OPD or in the clinic. And take care and get well soon. Thank you.